Hi, you got Dave Man Max 6, and we're back with the doc. We were in a little bit of a hiatus, a lot going on over here, but we're back now, so we're going to get started right away with your questions, you guys. Sorry for the little delay, but keep sending a question. We really like it. We're very, very happy to answer that for you. Doc is the man. So here's your question number one, Doc. Hey, David, Doc is the man. There you go. This guy just said it. Also, thanks to you. I was wondering if I can do a follow-up question to sleep apnea TRT. I'm a 43-year-old male. I do have sleep apnea, which I am treating. I got my CBC lab report back, and my HGB hemoglobin, which is 15.1 gram per deciliter, and my HCT hematocrit, which is 44.1. These numbers show that the sleep apnea therapy is working. And someone's trying to call at the same time. So it's safe to say it's working. So is it safe to say I can start a blast of testosterone for 600 milligrams a week for 12 weeks and then cruise at 150 milligram for 16 weeks and repeat this protocol for the rest of my life? Also, does Dr. Rand know of any doctor in NYC that he recommends? Thanks, guys. Love the series. Very helpful.
Last part of the question, any doctor where?
In New York City.
Oh.
If you have any compadre over there.
I don't right offhand, but with regard to the sleep apnea, yeah, obviously the treatment is working because to have a hemoglobin and hematocrit of, I think it was 15.1 and 44 is actually pretty close to optimum. A lot of people think that you need a very high hemoglobin in order to achieve, endurance greatness, if you will. You really don't. I mean, we've come to find that there's so many other factors involved in endurance and in the ability to achieve things athletically. Yeah, hemoglobin carries oxygen, but you need the buffering systems within the cell. Your mitochondria have to be operating properly, etc. So to go above, I'd say 16 and a half is really unnecessary. And I mention this just because I know it's a little off topic, but when I tell people, your H&H is a little high, you probably have sleep apnea. I tell them that, essentially they're training in their sleep. You're dropping your oxygen saturation enough where you're telling your body to create more hemoglobin. And they go, you can see it, hitting like, wow, so I'm getting the best of both worlds. I'm snoozing and I'm training, I don't have to do cardio anymore. The problem is the blood just gets too thick. And, it's kind of the analogy I use. Like, you get a bigger pickup, or you get a bigger bed in your pickup truck, but you got too many trucks on the highway. So you're not really getting anywhere with what you're trying to do. And really, I have some world champion athletes in different sports, endurance sports, that have hemoglobin below 15 even. And I try and keep patients around 15 and a half hemoglobin, and just FYI, hematocrit is roughly 3 times hemoglobin. So, I say, 15 hemoglobin roughly means 45 hematocrit. So, again, it sounds like his therapy is working because, there's a reason why even endurance athletes will use testosterone, because, it leverages that ability of the body to create more red blood cells and build more hemoglobin. And, again, that's what tips me off when I see somebody with a 17.8 hemoglobin. I go, okay, you must not be breathing well at night. So, apparently his therapy is working. As far as the testosterone goes, a standard replacement dose is about 1 cc of testosterone cypionate, 200 megs per ml per week, to see, then how treatment goes, how fast you metabolize it, how you don't. I will add, though, that there are some studies showing that as much as 600 milligrams per week, and, it's not going to be adopted by the AMA probably in our lifetime. Because there are some side effects that come into play here. One of which is what we're referring, and what testosterone gets converted into, estrogens and dihydrotestosterone. But as long as you keep those under control, to use Chris Bell's movie title, you can get bigger, stronger, faster without negative side effects. But I can't recommend that to anybody. It's not standard of care. But
you would say it's a safe range, though, 200 to 600.
Well,
somewhat safe.
I'm mentioning, some studies, and I use the joke, and please, if you're Hungarian, don't take this the wrong way, but, well, I won't even say that. I usually say, some of these studies that are out there, are horrible, and I say, the Hungarian Journal of Bad Science, but there's some studies that were poorly done, in other words, and people will quote those. I'm talking about, and there aren't a whole lot in English and in our system because we're not interested in that here. I say we, the established medical community. But there are some studies showing that when you increase the dose like that, as long as you watch, again, for things like estrogen excess and dihydrotestosterone excess, and of course the effects of those being, for example, elevated H&H, because when they found now that when your DHT goes high, it tends to promote erythropoietin release and therefore more red blood cells, etc. So as long as you keep an eye on those, which is the way it's supposed to be done, period, which is why I encourage everyone to actually use their doctor, not just for the regular checkups, but particularly when you're training and you're using some of these techniques that they're choosing to use. Just not everyone falls nice and neatly underneath the bell curve. So make sure you're doing okay, because if you're an outlier, you want to make sure that, or if you have sleep apnea, that it's not harming you. And well, I guess it probably said enough about sleep apnea. Keep that under control. There's a great company, by the way. I don't get a free toaster from them or anything, but Novosom does at-home sleep studies, and it seems to me most insurance companies are covering them. So, if you go to your GP and say, hey, I think I've got an issue here, especially if you have to use another espresso to get going in the morning, and you're using, certainly excess testosterone. Quick comment, usually with a replacement dose you're okay, but if you don't have sleep apnea, but even if you don't have sleep apnea, once you go above 1 cc a week, you tend to make more and more H&H anyway. So if you're in that category with sleep apnea anyway, ask your doc for this Novosom at-home sleep study kit. It comes in a box about yay big. You hook it up to yourself, and then you plug it into your wireless to send the report, and you're done. And I think they like doing that because it's cheaper than at a UCLA fully staffed sleep study. So anyway,
cool. Thank you, Doc. Okay, next question. I'm in my early 20s and I have been told by my primary physician that I need to be put on TRT. I was wondering what the doctor's thought were on using Aromasin as an AI long-term versus using Arimidex. I've read that Aromasin is lipid-friendly, may increase IGF-1 and lower SHBG, which increase the ratio of free to bound testosterone.
Well, before I answer what I think the main question is, was it early 20s?
Yeah.
That's unusual. That's when you're supposed to be in your prime. So the first thing I would submit is, with all due deference to his GP, and I didn't get the full story, obviously, and all this is not meant to be medical advice, as we disclaim early on. But first thing that comes to mind is, let's figure out why you have low testosterone at such a young age. One secondary issue could be the pituitary has, and it's not usually cancerous, but a microadenoma where you got a little tumor on the pituitary. The pituitary is about yay big, right underneath the brain, and it sends a signal to testicles to make testosterone. If there's a little tumor there, you might be disrupting that signal, and that might be worth investigating, because instead of having to start treatment for the rest of your life, if they go up pretty easily through the mouth. Surgery. I don't mean to make it seem like it's no big deal, but it's relatively minor compared to some other surgeries, open heart surgery. And you remove the tumor and you're back in action. You might want to investigate, in other words, a little further to see if it's testicular, primary hypogonadism or secondary. But to your question, I'm not sure the reason for the Aromasin or Arimidex, the estrogen production blockage, but certainly if you're going to use replacement therapy, almost invariably you have to use something to block the conversion from testosterone into estrogen. If the question is, getting to the point, I think, what he's asking me, Aromasin versus Arimidex, There are some differences. Aromasin isn't quite as effective, and we're really kind of slicing hairs. I forget the percentages, but 85% versus 93% at reducing the quantity of estrogen. Yes, there's a dosage that comes into play, if you use more or less of the other, but aromasin is what we call a suicide inhibitor. And before we get into too much physiology that probably nobody cares about, my preference is simply using an aromatase inhibitor like Arimidex. There's also something called letrozole, which goes under the brand name Femara, which is actually a more effective aromatase inhibitor, meaning you can reduce your estrogen even further with a smaller dose that actually lasts longer of letrozole. But letrozole was shown to increase the liver enzymes a bit, certainly a bit more than anastrozole when they were inventing these products.
Which one? I was going to ask you this question actually. Which one do you prefer the most out of all these guys?
To me, it's a no-brainer. Use anastrozole.
Okay.
Why? Because you block the conversion from testosterone into estrogen to begin with, which is preserving the very thing that you're putting on board or trying to promote. And let me come back to that in a minute because it applies to I think to this gentleman. And then you're obviously reducing the estrogen to a certain degree. We do need some estrogen as guys. It's not one of those things where you're trying to eliminate it. You need some estrogen for brain health, for cardiovascular health, for joint health, but it's a little amount, and it tends to be a steady amount. Girls need big swings in estrogen for reproductive purposes, and obviously we're not plumbed that way, and it can be a disaster for us. And I'm going a little far off topic here, but there's side effects that are usually attributed to steroids, which are really from excess estrogen, making you guys and females moody and irascible, along with holding water, all that kind of stuff. But to the point about reducing SHBG, that's really not so much aromasin versus Arimidex as it is, and by the way, anastrozole, I use the term interchangeably sometimes, I apologize, but anastrozole is just the generic for the brand Arimidex. Okay, but aromasin versus Arimidex isn't about the drug itself, it's about what the drug is doing. There's a sweet spot of roughly 15 to 20 picograms per milliliter of estradiol, and we use estradiol because it's the most prevalent estrogen. We use that as a surrogate marker for all the estrogens, but using that as a gauge, that sweet spot, and it occurs, there's a tipping point, I guess I should say, somewhere around 21 in my experience, under which all of a sudden SHBG drops and free testosterone therefore goes up. So you're getting more juice for the squeeze from your total testosterone. Instead of an average of say 2%, you might get 3% free testosterone. And for all the non-math wizards out there, who say, well, big deal, 1% increase. It's not a 1% increase. Going from 2% to 3% is a 50% increase in what's free and available to you. So, Arimidex is very important for all that, and we've gone through this before, limiting all the bad side effects of too much estrogen. But I think it's the ideal way to govern it. And maybe in this gentleman's case, what's happening is he's got low T because his liver is converting too much testosterone into estrogen, and maybe the doc is just using one of these two substances, again, my preference would be Arimidex, to stop that conversion, therefore raise his total T, because you're not converting into estrogen anymore, getting more juice for the squeeze by getting in that sweet spot, and that's, you need some. So I say, anything less than 15, and you start to run the risk of not having enough estrogen on board. And maybe he's going to govern it that way.
Gotcha. All right. Thank you, Doc.